Over the past several weeks, our incredible caregivers across Colorado and western Kansas have responded with courage, compassion, and kindness. Social distancing, masking, hand washing, and stay-at-home measures have clearly demonstrated that we can slow the spread of this disease. We know that COVID-19 has created uncertainty about your healthcare experience. It has caused some fear and anxiety about the healthcare system. At the same time, we also have patients desperately waiting to schedule their important procedures that were delayed when this crisis first started. A team of exclusively physician leaders from across Centura has assessed the virus in our communities and our clinical readiness to begin procedures that are medically necessary and time-sensitive. This physician team has put your safety and the safety of all of our caregivers first. They also recognize that care decisions are best made between you, the patient, and your personal physician. Together, you can determine the best course of action for the timing of your care. We want to continue to be your trusted health partner through these challenging times, and as each of us tries to find our new normal. Today and every day, our first priority is the safety of our 21,000 caregivers so that they are there when you and your family need them the most. Now I'd like to turn it over to Dr. Shauna Gulley, Chief Clinical Officer, Pediatrician, and Internist.
Safety first, people always. Our relentless focus on building a culture of safety has never wavered, even with the extreme challenges brought by COVID-19. We know that coronavirus has created a sense of anxiety and in many ways, a new normal for how we move through our lives. That said, your wellness is our priority. So as we navigate this new normal, as your healthcare team, we have added even more safeguards for your protection for both clinic visits and for time-sensitive procedures. Today, we want to share more information to alleviate your concern and also to help you know what to expect at Centura Health. I'm so happy to be joined by two of my physician partners today, Dr. Becky Vogel and Dr. Mark Murray. Welcome.
Thank you.
And joining us remotely from his clinic is Dr. VanSickle. One of the things that I have on my mind today, especially as we have opened more facilities across our environment, is it safe for me to have procedures done at Centura Health?
Safety has always been the number one priority of Centura Health, and we have worked investigating, looking at multiple different strategies to move forward to ensure that we're even making this more safe as we move forward.
And I agree. I think safety is the number one priority. And what we've come up with, we think, is the most comprehensive approach to ensure your safety when you come in. And every step of the way developing the plan, we thought about the safety of our patients and as well as our staff.
Another question I have is around clinics. Is it safe for me to receive care at my physician clinic?
The same kind of recommendations that we've made for you coming into the hospital are also being worked on for our clinics as well. And it really is, I cannot highlight enough that safety is always at the forefront and always first in our minds.
Your safety is really a process. It starts at home before you even meet us at clinic. It moves on to the clinic setting here, then on to the hospital where your procedure will be performed, back here to a clinic setting during your follow-up, and then on to your home again. There's no one particular area where safety is paramount, but all of them put together matter.
And some of our clinics also have telemedicine, isn't that right?
Correct.
Lots of different ways to stay safe and receive care. It's great. So you talk about this multimodal, comprehensive approach. What does that look like at Centura Health?
Well, our plan really is a two-pronged approach. And the first prong of that is to stay at home. We think by staying at home, you can ensure you don't come in contact with people who may be harboring the COVID-19 virus. While you're staying at home, we're going to ask you to check your temperature to ensure that you don't start coming down with symptoms as well. And during your stay at home, we're going to make sure you're connected with a provider that can answer any questions that you have. And that's the first prong. The second prong is that we're going to give you a COVID-19 test about 2 days prior to your procedure. And we think that the combination of these two prongs is probably the most comprehensive plan to ensure your safety.
All of these procedures are designed to interlock with one another, providing multiple layers of safety and security for you, and multiple opportunities for us to communicate with you, with our hospital partners, and with your primary care physicians. Together is how we're going to keep you safe.
If I'm sitting at home today wondering about having a procedure done in one of the facilities at Centura Health, I have additional questions too, like what if my family member is sick? What would you tell me to do in those circumstances, Dr. Vogel?
I really would say even before this COVID-19, trying to limit your sick contacts before you come in procedure is a wise decision. It really helps you get through your procedure in a more predictable manner. I think in this COVID pandemic world, we have to even be more mindful about that and really encourage isolation as you can, even within your home, to avoid those sick contacts.
Now, we talked a little bit about time-sensitive procedures, but what if it's an emergency? What do I do then?
We are prepared at all Centura facilities to deal with those emergencies. That's what we do every day, and we have a very safe process when you come in to maintain your safety, to encourage isolation among our staff, among the patients as soon as you come, and we will always be there able to take care of you in mind, body, and spirit.
Another question I have is around masking. Masking is very important these days. We see people at the grocery store and at the bank wearing masks. How do masks figure into the conversation around time-sensitive procedures, Dr. Murray?
I think we are going to go with the governor's guidance, and that includes continuing to have the social distancing, but also wearing masks when you're outside of the house to ensure that you can be safe when you're outside of the house. We know it's tough and people aren't used to wearing masks, but it's part of our new reality now. And so we would just say that whenever you're going to leave the house, you need a mask. With that, when you come in for your COVID-19 testing that we're going to supply for you, we're also going to include with that a package, a gift pack, if you will. And in that will include a mask for you to use.
One of the things that makes me a little bit concerned about having a procedure is not being able to have a visitor with me. That's part of my mind, body, and spirit wellness. So how is Centura Health going to help me with that?
We also believe that that's really important in your recovery process, and so as soon as the stay-at-home requirements are lifted, you will be allowed one visitor.
As always, if you have additional questions, please ask your doctor directly. They will be able to advise you of the process and next steps. At Centura, we extend the healing ministry of Christ, and we care for people in mind, body, and spirit. During these unprecedented times, we are dedicated to partnering with you to safely deliver the care you need.